Hi everyone, my name's Mark Bates. I am a metabolic health coach, and today's topic is we're going to talk about the hidden heart attack risk. Okay? Most heart attacks occur in people with normal cholesterol levels. That's a key point. The single fact challenges decades of conventional wisdom about heart disease. While cholesterol management remains essential, focusing exclusively on LDL numbers misses a more powerful predictor of cardiovascular risk. What if the biggest threat to your heart isn't even being measured at your annual checkup? Research increasingly points to hyperinsulinemia, too much insulin, as the silent epidemic driving heart disease. This condition serves as a 6.7 times risk multiplier for second heart attacks, far more potent than traditional risk factors like LDL cholesterol. However, to understand why insulin matters more than cholesterol for many people, we must examine how heart disease develops. So, beyond the cholesterol numbers, your arteries have three distinct protective barriers against heart disease. Modern diets and lifestyles compromise all of them. When doctors focus primarily on cholesterol numbers, they miss this crucial reality. The damage to your arterial defenses matters more than the amount of LDL in your bloodstream. Consider this analogy. LDL particles are like raindrops, and your arterial walls are like a house. A well-built house with excellent waterproofing can withstand heavy rain without damage, while a poorly maintained house will leak even during a light shower. The same principle applies to your arteries. Some people with high LDL never develop significant heart disease because their arterial defenses remain strong. Others with normal LDL levels suffer heart attacks because of their protective barriers have failed. This explains why coronary artery calcium, CAC scoring, has emerged as the most accurate predictor of future cardiac events. It measures actual disease in the arteries rather than risk factors in the blood. The first barrier, your glycocalyx. Your first line of arterial defense is a structure most doctors never mention, the glycocalyx. This delicate mesh of proteins and sugars lines the inside of your blood vessels, forming a protective barrier between your bloodstream and arterial walls. When intact, it prevents LDL particles from contacting your arterial lining. What damages this crucial barrier? The modern diet. Research shows the glycocalyx can be severely damaged within 2 to 6 hours after a high-carb, high-sugar meal. This damage increases the likelihood of LDL particles penetrating arterial walls, regardless of how much LDL circulates in your blood. Even more concerning, the glycocalyx takes 8 to 12 hours to recover. The glycocalyx remains perpetually compromised for people who are consuming multiple high-carb meals and snacks throughout the day. The second barrier, your endothelial cells. If LDL particles breach your glycocalyx, they next encounter a single layer called the endothelium. These specialized cells form tight junctions that normally prevent LDL from passing through. However, inflammatory conditions cause these cells to malfunction in two critical ways. First, inflammation triggers transcytosis, where endothelial cells transport LDL particles across the barrier. Studies show that inflammatory markers like tumor necrosis factor alpha can increase this transport by 4.5 times. Second, inflammation accelerates endothelial cell death. As these cells die and are replaced, temporary gaps form between them, allowing LDL to leak. Both processes occur regardless of how much LDL circulates in your bloodstream. The condition of your endothelium matters more than your cholesterol number. The third barrier wall, your arterial wall. LDL particles that breach the glycocalyx and endothelium encounter a third defense, the protoglycans in your arterial wall. These structures can trap LDL particles or allow them to pass harmlessly through. What determines their behavior? Once again, metabolic health plays a crucial role. Blood from insulin-resistant and diabetic patients shows significantly higher LDL binding to protoglycans than that of metabolically healthy individuals with the same cholesterol levels. One study found that blood from type 1 diabetic mice caused 8 times more retention of LDL particles in arterial walls compared to healthy mice with identical cholesterol levels. Okay, real quick, you know the drill. Please, if I'm doing something good here, like, subscribe, click the bell to get notified. Your help is appreciated. We do appreciate everything you do for the channel. Okay, what's the common thread? And that's hyperinsulinemia. What damages all three protective barriers? The evidence consistently points to hyperinsulinemia and insulin resistance. This metabolic dysfunction affects approximately 51% of people in developed countries, making it a silent pandemic driving numerous chronic diseases beyond heart disease. The connection becomes even more clear when examining heart disease patients directly. A European study of people living with coronary artery disease found that over 75% had diabetic dysfunction, even though many had never been diagnosed. This explains why traditional cholesterol-focused approaches often fail to identify those at highest risk. The actual danger lies in the metabolic dysfunction that compromises your arterial defenses. Okay. The role of oxidized LDL. Not all LDL particles are created equal. Native undamaged LDL appears to cause minimal harm to arterial walls. The real danger comes from oxidized LDL. Recent research shows that even minimally oxidized LDL can cause significant endothelial cell death and dysfunction. When combined with other markers of metabolic dysfunction, oxidized LDL measurements show a nearly 17-fold increase risk for arterial disease. This raises an important question. Does LDL oxidize before or after entering the arterial wall? Well, the evidence increasingly suggests that oxidation occurs first in the bloodstream, and these damaged particles then attack and penetrate the arterial defenses. This would explain why metabolically healthy populations can maintain excellent arterial health despite relatively high LDL levels. Beyond LDL, what really matters? If protecting your heart is the goal, what should you focus on? First, consider a coronary calcium scan. Talk to your doctor and get a prescription for this. It can cost you a few dollars, but it's usually not an overly expensive test. This simple 5-minute CT scan directly measures arterial diseases and accurately predicts future cardiac events. A 0 score, which indicates no calcium deposits in the arteries, is associated with minimal risk, while scores above 400 signal significant danger. Okay? But I'll warn you about one thing. Even if your score is above 400 or 500, don't immediately jump to the conclusion that you're going to have an immediate heart attack or that you need to go to the cardiac surgeon and have stents or something put in place. What you need to figure out is how much of that calcium has been calcified completely. So it's hard, not soft. Because the hard calcium doesn't break off and cause heart attacks for the most part. It's the soft stuff that hasn't quite formed up yet that does that. And the best way to do that, and once again, this may cost a few bucks, is in 60 or 90 days, take another scan and see if the number is going up or if it's going down or if it's staying the same. If it's staying the same, that's relatively good news. that means it's not growing. And if it's growing, that's when it's soft. Okay? So just be careful on that. Talk to your doctor about this. So let's address the root causes, okay, that damage your arterial defenses. First and foremost is insulin resistance and hyperinsulinemia. These conditions damage all three protective barriers. Low carbohydrate diets have improved insulin sensitivity without adverse effects on LDL cholesterol. Chronic inflammation. Inflammatory markers like C-reactive protein and tumor necrosis factor alpha directly damage endothelial function. Anti-inflammatory diets and lifestyle interventions can help. Oxidative stress drives LDL oxidation and glycocalyx damage. Antioxidant-rich foods and minimizing exposure to environmental toxins can reduce the oxidative burden. Hypertension, elevated blood pressure, this is a big one, damages endothelial cells and accelerates arterial aging. Addressing insulin resistance often naturally improves blood pressure. Okay, here's the test. In your arteries, where do most of these plaques form? And where does the damage on your arterial walls occur? It occurs at the branches. And the branches are where you have vertices forming in the blood flow, right? That cause the pressure to actually be higher there than your overall blood pressure. And if your blood pressure is high already, that makes it really high there, and that causes potential damage. So getting your blood pressure under control is a major factor here. Once again, if your blood pressure is high, work with your doctor. There are a lot of very good medications that they can prescribe that will help with that. But that's a big reason why you have plaques forming, is that there's this pressure where the vertices are forming at the branches, and that's where a lot of problems occur. So just keep that in mind. Okay, the path forward. The science of heart disease prevention is evolving beyond simple cholesterol metrics. The emerging picture reveals metabolic health, which refers to the body's ability to efficiently process and utilize energy as the foundation of arterial protection. Understanding these mechanisms provides valuable context for those concerned about heart health, especially those transitioning to low carbohydrate diets. If one's LDL rises slightly, but insulin sensitivity improves dramatically, the net effect will be, or should be, very positive for arterial health. However, individual responses vary. Everyone is a little bit different. Regular monitoring of comprehensive metabolic markers, inflammation indicators, and direct measures of arterial health like coronary calcium can provide personalized guidance. The most powerful insight from this research is that arterial health depends not on a single number, but on the integrity of multiple protective systems. We can better understand heart disease risk by focusing on metabolic health and the root causes that compromise arterial defenses. This approach explains why populations with excellent metabolic health maintain healthy arteries despite varying cholesterol levels, and why modern societies with poor metabolic health suffer epidemic rates of heart disease despite aggressive cholesterol management. The heart attack you prevent may be determined less by your cholesterol number and more by the strength of your arterial defenses against whatever LDL you have. Okay, thanks for watching, and once again, please leave a comment, ask a question. We will answer all of them. Thank you.